All right, so we roll up on the patient. We got a call for chest pain. So we roll up. Scene is safe. Put your gloves on. General impressions or whatever. Yeah, he looks to be sitting up, and he's kind of hunched over or whatever. We're gonna call for additional resources. Medic. One patient. Nature of illness. We're gonna go into primary. So, hey sir, what's going on? Can you tell me a little bit about what's going on today? Get his chief complaint. Always having chest pain, difficulty breathing, whatever. Okay. So his airway is maintained, and he can maintain it himself. It's clear because he's talking. Check breathing. Listen to his chest, lung sounds. All right, I'm just gonna listen to your lung sounds. If you could take a few deep breaths for me. Okay, it's he's wheezing and it's a little labored. We're going to C, check skin. Oh, he's cool, moist and pale. Then we go into check his pulse. Okay, he's got a pulse. It's a little weak and regular, whatever. Check to see if he has any bleeding. Any bleeding I should know about? Anything? What's going on? No. Okay. We're gonna choose to load and go. So we get him on the ambulance. Then we go in our secondary. As I'm taking vitals or whatever, my partner would be getting a sample history. So, hey sir, what are your signs and symptoms of the chest pain? What are your symptoms of the chest pain? Whatever. Then we go into allergies. Are you allergic to any medications? Any allergies we should know about? No. What kind of meds are you on? Any history of chest pain or cardiac problems whatsoever? When was the last time you ate something? And what were you doing when the chest pain started? Boom. Then we get OPQRST. So when did the pain start? Does anything make it worse? What does the pain feel like? Does it spread anywhere to your arms or anywhere else? How bad is it on a scale of 1 to 10? And how long does it last when it comes, or is it constant? Boom, done. So then we check vitals, check his pupils. They constrict to light. Listen to his breathing again. This time in 6 fields. Okay, he's got 12 breaths per minute, but he's still a little labored breaths. So we put oxygen on him. Probably put the cannula in at 5 liters per minute. I don't really know, 4 maybe. Other vitals. Get his blood pressure. Obviously, you can't do that on a pillow. Right, you'd attempt to get the blood pressure. And what's the last one? Lungs, pupils, blood pressure, pulse. Okay, 60 beats per minute, weak and thready. So he's presenting symptoms of shock, so we'll put the oxygen on. He's already got the oxygen on. Transport, keep him warm, throw up in the cold room, and elevate his feet. And then we give a report to the hospital. Actually, before that, we kind of narrowed down on the cardiac problem, so we're gonna check that system for any irregularities. So maybe check for the edemas, check for the jugular vein distension. Yeah, things that would allude to heart problems. I want to treat it too. So, we'll give him the nitroglycerin if he's having chest pain and prescribed it. And then, if his blood pressure was above 120, and then if he presented symptoms of a heart attack, signs of a heart attack, like the edemas or the jugular vein distension, we can give him the 4-baby aspirin. Yeah, and then continue to monitor him on the way to the hospital. Then get the hospital report. So, I don't know. Hospital, Danbury Hospital. This is the EMT. We have a middle-aged, older male in his 70s who presenting symptoms of shock. We're currently treating him with oxygen. His chief complaint is chest pain. He has edemas on his ankles. His blood pressure is whatever 120 over 80. We gave him nitroglycerin and 4-baby aspirin. Yeah, the patient currently has oxygen on. He's getting oxygen. And that's it. Dropping off at the hospital.